living a full life with an irregular heartbeat, help for some who suffer with atrial fibrillation, and the battle of the sexes and the flu. This is Carolina's Healthcare System Network News.
It's a very common heart condition, usually affecting people over 65. An estimated 3 million Americans are living with it. It's called atrial fibrillation, or AFib. It's an irregular heartbeat that can lead to blood clots, stroke, heart failure, and other heart-related complications.
Atrial fibrillation is an electrical abnormality of the heart. It affects the upper chambers of the heart, which are called atria. What happens is the atria quiver. They have an electrical derangement and they make your heart go fast or sometimes slow. Atrial fibrillation is experienced by patients as palpitations or fast heartbeats or irregular heartbeats.
But the condition can be controlled.
There are ways of managing atrial fibrillation. For example, we give patients medications such as antiarrhythmic medications, which we try to control the arrhythmia, the atrial fibrillation, so they don't have any more AFib. We also give them medications that control the heart rate when it goes fast. We also can do procedures like cardioversion, where we reset the heart back to normal rhythm.
And most importantly, you can lead an active life with it.
Our goal is to prevent stroke and have them go back to their quality of life that they would like to have. So it's really a matter of back and forth discussion of what medications work for them, what procedure is appropriate for them.
And Dr. Saxonhouse's advice for people who may have atrial fibrillation?
Atrial fibrillation needs to be thought of as a serious problem, but can be controlled and patients can have a normal life with it.
And now there's new technology available that can help some people who suffer from AFib. Carolina's healthcare system, Sanger Heart and Vascular Institute, is the only location in the region now offering an innovative device called the Watchman. It's a treatment alternative for certain patients with AFib at risk for stroke who cannot take the blood thinners that are commonly prescribed as treatment.
So the Watchman device is a procedure that's done under general anesthesia, and we place basically a big IV in the leg vein, and then we go up to the heart and we place a little plastic sheath in there. And then under ultrasound guidance and x-ray guidance, we deploy this little device and plug it up like a button in a hole.
I've actually had AFib now for probably about 10 years now. I was a police officer and I had to chase somebody, and I went about 3 blocks and I fell down. I don't remember exactly how I fell down, but when I came to, one of my coworkers was there and said that I'd passed out, and I was having a hard time breathing. Felt like my heart was jumping out of my chest. I couldn't perform at the level that I'd like to, especially being a law enforcement officer. It's very painful. I love to work in the yard. That was my way of relieving my stress, and I love to work with wood. And I quit doing that because I was afraid that, if I cut myself, that I possibly could bleed to death. So I got to where, I guess what they call it, a couch potato.
Studies were done looking at this device versus Coumadin, and in those studies, which now we have results out to 5 years, the devices were equally effective to Coumadin in preventing stroke, and actually had a lower all-cause and cardiovascular mortality. So patients were less likely to die over 5 years if they used the device than if they took Coumadin.
For James, the Watchman turned his life around.
It just blew me away that I didn't have to worry about profusely bleeding, and I was so happy. So I started going outside and doing a little bit, and now I'm at the point where I do what I want to.
We think this is an important advance in medicine and meets an unmet need. Now we have something that seems to work very effectively at preventing stroke, and hopefully we'll keep these patients from having what are really devastating events.
This device has saved my life.
Women, take note. You are more protected against the flu virus than men, so finds a recent study. The primary female hormone, estrogen, is the reason. It provides a barrier so the disease is less severe in women, making it less likely to spread to other people. The researchers noted, though, that it's unlikely there is a population-wide effect in protecting women against the flu. But these new findings suggest the estrogen women already take for hormone replacement therapy, birth control, infertility treatments, or other medical uses could play a powerful role in reducing infection. Women, the weaker sex, says who?